Hey everyone, welcome back to the Neurohealth broadcast. I'm your host, Dr. Joe, and today we are joined by Dr. Donald Dennis of Donald Dennis Atlanta Center for ENT. We have a doozy of an episode for you. This one is quite a bit longer than our typical episodes and quite a bit heavier than our traditional episodes, but it is fantastic. Dr. Dennis is going to talk to us today about mold toxicity, mold exposure, and what we can do about it and what he's doing with his sinus surgeries as well as his products with the Microbalance company. This was a fantastic episode, so if you or anyone you know are experiencing the effects of mold toxicity, Dr. Dennis is the guy to learn and hear about it from. So after a quick announcement, we'll get right into it with mold toxicity with Dr. Donald Dennis. This podcast is brought to you by Delta Neurohealth, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neurohealth broadcast. I'm your host, Dr. Joe, and today we are pleased to be joined by Dr. Donald Dennis of Dennis Surgery Center and Microbalance Health Products. Dr. Dennis is an expert in the treatment and management of mold toxicity. So I'm really excited to get to talk to you today, Dr. Dennis.
Same here. We should have enjoyed this presentation.
Yeah. And I know mold is something that personally hold near and dear to my heart for negative reasons. Is something that has kind of uprooted me and my family's life a little bit. So, and I know it's, wreaked havoc on a lot of patients' lives as well, as I'm sure you know. So I'm really excited to get an in-depth look at what you're doing specifically to help those patients who are suffering.
Okay. Well, I'm glad to do it. I was trained at Johns Hopkins Hospital in otolaryngology, which is ear, nose, and throat surgery, and then came to Atlanta in 1980, and actually started getting interested in mold probably in the late 80s. And then we grew our knowledge base over the years with thousands of patients, and especially when the testing for mycotoxins came out, that really changed everything and made people aware of why they were getting sick. So over the years, we probably had over 30,000 patients that we've treated so far. And probably half of them need surgery, half of them don't. The main thing they all need is to get their environment straight. And I'll give you one principle before we get started is if the patient has significant neurological symptoms, like cognition is really bad, low energy level, or paralysis or blindness or deafness or tremors, those kinds of things. If they have those, in my experience, it's best for them to leave the environment, not take anything with them, and get into an environment where they know they're getting better. This is for really sick people. If you do that one step, then all the treatment works. If you don't do that step, no treatment works.
Mhm.
So that's the take-home message.
So, so Dr. Dennis, in order for someone to even be aware that mold is an issue in their environment, sometimes it isn't as obvious as people might think. So what are maybe some early symptoms or some indicators in the home that mold may be an issue?
Well, the easiest way is to get mold plates on microbalance health site, and you can put them out or do tap testing with them where you open the plate and tap it on what you're testing. And in about 5 days, you read it daily for 5 days, and you count the little colonies on it, and you want it to be 0 to 4. If there are like 30 or 40 colonies, you know you got a really bad situation. That's one way. The other way is to get a urine on yourself, a urine mycotoxin level. And two principles that are simple. If you can see mold, A, or smell it, B, it's too high for human health without testing. So then you need to find the source of the moisture that caused it, remove the source, and remove all the contamination. And the problem is a lot of the companies that do this don't have any training in human health, and they do some things that aren't good for people who are mold sensitive. So, there are more companies that do it wrong than do it right is the problem.
Are
So you want me to
can
get started?
well, I was gonna say, who I guess who might be some of those companies that you really find to be doing it right?
There's two companies that I like to use. One person's name is Heath Johnson, and they're Southeastern Allergy. I can give you the phone numbers if you want them. And the other one is Kenny Gray. They both have companies that know how I want it done for people who are very sick with mold. They know all the reasons why the patients get mold and all the things that have to happen. And I'll go over a lot of that on this presentation.
Perfect.
But do you want any of that data, those people's contact?
Yeah, I think that would be helpful, and we can include that in the show notes afterwards.
So Kenny Gray, his number is 770-315-9291. And the other name is Heath Johnson,
Mhm.
and his number is 770-315-2324. So 770-315-2324. Both of those, they're different companies. They both know each other, and they do a really good job.
Excellent. Thank you for that.
So this first slide, this is what you'd like your environment to look like. Perfect air on the beach.
Mhm.
So there's a new device I'll show you later that is invented in Israel that is called a plasma pure auto clean 1500 by Well Air. The company here that sells it's Well Air. I'll show you that in a minute.
Mhm.
The air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely powerful because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and at work. You breathe 1,080 gallons of air per day, so no treatment can overcome that much volume. The air must be clean in order for you to get well.
Okay, this is a repeat of what they said. So you're really breathing 3,000 gallons of air a day. It's more than what it says. And so the air you breathe is 5x more important to your health than all treatment rendered by hospitals, doctors, and medication. You need to read that about 10 more times, because that's where you need to spend the time, on the air, rather than trying to medicate yourself out of a bad environment. That's not going to ever happen.
Mhm.
Okay, so the CDC had Mold Awareness Week, August of 19, which was a long time coming. They do tap tests on patients' clothing, and we do that on everybody. So we know what they're breathing by testing their clothes when they come in. And so we have a simple questionnaire, and we pay attention to the smell. A lot of times you can smell that people are in a moldy environment. Then we do urine mycotoxins and the serum IgG mold level, the IgG of molds in the serum. And resources are on sinus5.com and Sinusitis Wellness. Those are the two web pages that we have. Sinus 5 is you got all the products, and Sinusitis Wellness is all the articles and data, all the training. These
Dr. Dennis, I just want to pause for just a second. Your slides are not coming up full screen. They're showing individual slides at the moment.
Oh, see, mine is a full screen. Let's see. I want to know how we fix that. So you're seeing one slide?
I'm seeing them all individually laid out in a grid form. Yeah.
Oh, wow. Let's see. See, I see it on a grid now. I wonder how you now you see a bigger slide.
Yeah, that might be better.
Let's do this.
Yeah.
Okay, we just went over this. Now, this is the slide we're on that. Can you see this good?
I can, yep.
All right, so these are the major fungi that infect people, and these are the toxins they make. We'll go over this a little bit more. Now, this is interesting because Dennis Hooper, who's the guy that runs real-time labs, that does all the mycotoxin testing, he's a pathologist. So they go into a hospital pathology lab and get all the cancers that came in that are positive for cancer. And he assays them for all the mycotoxins. So only 87% of them are positive for mycotoxins that are known to cause cancer.
So
that's pretty high, isn't it?
That is very high. So when it comes to mycotoxin exposure, how many people do you suspect are infected, I guess, or struggling with that and not know it, and then it's leading to more chronic issues rather than some of the more acute issues that
I would
people.
say of the people who are in a bad toxic mold environment that is very bad for the health, I would say 80% of them don't know it.
Mm-hmm.
The reason I say that is because the people who have the genes that get sick are about 20% of the population.
Mm-hmm.
80%, there are three different genes and they're not related. One is chronic sinusitis. The second one is chronic sinusitis with polyps. They're two different genes. And the third one is the MTHFR, where they cannot remove the toxin from their body as fast as other people. So they get all the neurological symptoms and immune suppression and everything. Mm-hmm. So that represents 20% of the population. So you can have a person who gets chronic sinusitis but doesn't get the neurological symptoms because they can dump the mycotoxins. Mm-hmm. So you can have any combination of those three. And so you have people who don't have sinusitis at all, but are very sick because they can't dump the toxins, but they don't get bad sinusitis. Mm-hmm. And they still need sinus surgery to get it out of their sinuses, but they don't have typical infections.
So if that many people are struggling, and you said this seems to be a carcinogenic, right? Something that is potentially leading to cancer later on.
Yeah, and it's a slow stealth kind of sickness. They'll have to be in there for years and years before they get cancer. A lot of them have been living in moldy houses for 30, 40 years. And then you have a number of patients who never get cancer, even though they have high mycotoxin levels. Yeah. They have resistance.
And I've had another conversation with someone who treats mold quite regularly, and they listed that some people are some people are more like canaries in the coal mine, and then some people are more like the warrior genotype or phenotype,
That's right.
where right. So it's good that we have people who are maybe a little more sensitive to it because that kind of signals to the rest of the family maybe that this is not a good environment, even though it's maybe not good for them, obviously, in that moment, or they're struggling with it the most.
That's right. So now, if you add, what are you going to do here? So we do a HEPA air filter, and
Mhm.
now we add the Plasma Pure Auto Clean 1500 by Well. I'll show you that in a minute. Central dehumidification, that means the dry air blows on the coil and keep it between 40 and 50%. Now, some areas in the country may not need this, but most of them do if you have air conditioning. If you have air conditioning, the coil is going to be wet. And if you don't blow dry air on the coil is going to be black in a few months, you know. But if you put this other thing on there, it never grows mold either. Yep, this is the well air we just talked about. And then the central filter we like is called the April Air 5000. There's several April Air filters, but the 5000 is the only one that I recommend.
Mm.
And of course, no fiberglass in the airstream. So this is common, especially in Florida. All the duct systems are lined with fiberglass. And I'll show you some more slides what that does to the sinuses. It just totally destroys sinuses and it carries fungus. So think of fiberglass as cotton candy for fungus. So all the fiberglass will be black in a few years and blowing all the fungus into the house. And the sinuses react to the fiberglass particle itself. So the coil box can't have it, the ducts can't have it, exposed fiberglass.
Mhm.
And then they do the insulation they use a lot of times, this new spray foam, the open cell and closed cell. The problem with that stuff is, although it's a good insulator, it's got VOCs in it. And most of these patients are chemically sensitive. So the VOCs are toxic and they may take months to years to get out of the air in the house. So I don't recommend getting that either. We recommend what's called John Manville Comfort Foam, which is surrounded in plastic in the attic. So we'll go to the next slide. Now this is these two things. The Metafies are really good filters. They're the least expensive one. They've got several filters according to the room size that you have. And this thing is called the Ultimatum 1100. It's a little pricey. This one's about $1,500 or so. It's got a HEPA filter on the back, but it's got the ionizer in the fan, and the ionizer fills up a 20 by 80 room in 2 minutes and keeps replenishing it every 2 minutes so that all the air is free. So this is only weighs about 4 or 5 pounds, so you can take it with you on a trip. It doesn't have to be blowing on you, but it has to be in the room that you're in. So this is new technology that works for a lot of these patients. But you still have to get rid of the water and the burden of fungus that you have in the air. But all these things are helpful. And this is a picture. Go ahead.
Is microbalanced? Am I correct in when I heard that you guys are working on that ionizer to have a more affordable model, or is that something that I'm
Yeah.
mistaken? Yeah.
Yeah, we're working on that now.
Okay.
And so it's probably going to be a few more months, but we'll have it. And it'll be self-cleaning. The one that you just saw, you have to clean it off. It's not hard to do, but you have to spray it off with one of those spray cans that you spray computer keyboards with a wand on it. It's got 2 little electrodes on it. You can turn the fan off and just blow them off, and that's all you got to do. I have to do that once a month.
Mhm.
Now this is the one that this was made or engineered in Israel, and this company is the company that has it in the United States, but it's a Israel product. Now this is the neat thing about this one is this is rated for a commercial air system in a big building, so it's rated for 6,000 CFMs, and our homes are like 1,200 or so. So we want to do some overkill here. And the electrodes are cleaned themselves, so you don't have to ever clean it. So this unit's about $400, and you have to have a HVAC guy put it in. It's better you put it in on the blow side of the fan and hook it up to the fan power so it comes on when the fan comes on. And that does the whole house. So it makes 1 trillion ions per second with no ozone and no hydroxyl. That's the key. Most ionizers make a chemical, and you don't want that because the chemical destroys the cilia inside the sinuses, and also ozone is toxic. So you don't want any of that stuff. If you can smell it, you don't want it. So this has no odor. Airborne, so most words are like an airborne soup, mycotoxin, VOCs, they breathe through the nose and the sinuses, they go in the brains, the lungs, and the entire system. And the sinus mucosa and the brain have the highest concentration. There is no long-term wellness from chronic disease without clean air, water, and diet. Those are essential. The water, you can't have tap water, it's got chlorine in it. And chlorine makes you grow out yeast in your gut because it kills the bacteria, but it doesn't kill the fungus. So focus on a clean mold and mycotoxin-free environment, and go into a place where you know you're feeling better. If you don't know the air is clean when you walk in a place, it's no, go to another one. Go until you find when you walk in the door, you know the air is clean. You can tell right away. You know, it doesn't have an odor. It's not the thick and kind of soupy air, you know, that feels heavy.
Yeah.
You want just light, clean air. And then you got to have a yeast diet, which means no sugar, gluten, dairy, soy, and so bread, rice, potatoes, and sweets are gone. You have to eat meat, seafood, vegetables, and the fruits are going to be berries only for a while. So
a couple of follow-up questions there, if you don't mind. So I guess as far as the water purification system, which would you recommend? We got a really good recommendations for air. How about water?
well, you know, there's a reverse osmosis is okay. Everything's got some positive and negatives. The reverse osmosis works, but they have a holding tank, and so if it gets contaminated, it can be a problem. Usually they don't, but there's instances where they do. What my solution is, I get spring water, which has never been touched by anybody. And I just order a Mountain Valley spring water in 5-gallon glass jugs and put them on a cooler and get all my water from that, both at home and at the office. So I don't worry with filtration, but other than the reverse osmosis, there's still other good filters, but I don't really have one in mind to recommend.
Okay.
Now there's one that's easy. It's called zero water, which is fine, and you get those in most stores. And you can put it on. You can put it on a pitcher on your faucet. It's called zero water.
Okay.
And so this just shows you the picture of the olfactory nerves. All the smell nerves come down to the nose, and the chemicals go directly up those into the brain. They also go into the sphenoid sinus and into the pituitary gland because they're VOCs. So, you know, people used to sniff glue and get high. Well, the glue went into the brain. So when you remove the glue, the high went away. So think of VOCs and mold toxins like glue, the chemicals like glue. They go directly in your nose and then into your brain. So this is our definition we came up with clean air. If you control mold, you control chronic sinusitis and inflammation, and the air quality is key. So if you get the particle count down below 50,000 at 0.3 microns per 10 per cubic foot, that's usually adequate. And the mold plates are usually 0 to 4 colonies with a 1 hour plate exposure, or 0 to 2 for severely ill people who like are paralyzed or have severe cognitive decline. So now, this is a picture to show, this is the skin. The skin's inflamed, and this guy's very sensitive to mold. He gets eczema and skin rash every time he gets the mold. And this is the skin 2 hours after surgery.
That's an amazing, you said 2 hours after surgery.
2 hours.
That's an amazing difference. If
So,
you're
so
listening to this, I would recommend that you pull up the video version of this because this is pretty awesome.
you know, in the dermatology world, severe eczema and dermatitis like this cannot get cleared up in 2 months with all the steroids on the planet and give them all the medicine you can give them. So if you show a dermatologist this picture, they can't believe it because in their world, that can never happen because they have never been able to remove the antigen, which is fungus and mycotoxins that is causing the skin reaction. The antigen is the fungus and the mycotoxins. It's all one big soup. And so it's pretty impressive, I think.
Yeah, I would agree
So
with
you can
that.
imagine how happy this guy was when he woke up.
What other kind of symptoms besides superficial or was he experiencing?
Well, most of them have some cognitive issues, memory loss, concentration problems. And we grade them, normal is 10, and a lot of these patients will be 5 or less. And then energy level. So the energy level is 10 is normal. And if you're 5, you're likely to have growth hormone deficiency and pituitary damage from fungal exposure. And we work those up to find out who's got them. Then we go to the next one. Now, this is even more impressive. See these legs here? And the hands and the face? This patient had a heart transplant when she was 3 months old. She's 23 at the time of the surgery. And see her skin on her hand and her face and on the leg. Now, this is after she's got 4 dermatologists treating this. And this is best you could get. This is 6 days after surgery.
That's incredible. Yeah.
So if you show this to a dermatologist, they'll jump up and down and declare that you're lying, that these pictures aren't contemporaneous pictures, because they've never seen that in their life. This is removing the antigen causing the disease. So the picture on the left here is the CT scan. That white thing in the sinus is a fungus ball. And all of this should be black with air. It's all full of fungus and polyps. And this is part of the fungus on a mold plate. And you see the brown halo around the fungus? The brown halo is actually mycotoxins leaching out into the media from the tissue. So that's what they do in their body. They leach out into your body and they get into your brain.
Now, is this is running a CT on the sinuses, is that prerequisite to do the surgery, or do you do the surgery regardless?
You have to have a CT before you ever open anybody's nose, because you got to see what's going on, in 4 dimensions. Now, this is a good slide because it shows the slide on the picture on the right shows the average person can tell he may have a mole problem there, right? Yeah. They could guess they might have a mole problem. The picture on the left has got the same mole count as the picture on the right. So appearance doesn't mean a lot unless you can smell it, but both mole counts are the same in both of those places. So
yeah. And so that first picture that didn't look as obvious, obviously it had a lot of books, it had a lot of it had furniture, whereas the second picture was kind of an open room. Are there types of fabric and things in the home that tend to hold on to mold more than others?
Well, fabric does, and wood absorbs the mycotoxins. The only thing that doesn't absorb it is like metal or some other material like that. But you can get a house clean so the mold counts are good, But like say this desk over here,
Mhm.
the, the toxins go into the wood, not on top of the wood.
Mhm.
So you can clean that, you can scrub it with EC3 and everything, and that'll get it all off the wood, but it's inside the wood. So it then comes off later, it off gases and keeps making people sick. I used to not believe that until I had a patient who had brought, the only thing he brought from the molding place was a desk, but he took it outside and they took it apart with all the drawers and cleaned it thoroughly inside and out twice. And then he was still getting sick from it.
So do you recommend that people just get rid of all
I think it depends on how sick you are.
yeah.
If you're really sick and you've got cognitive decline in a low energy level, or you got paralysis or tremors, you just need to leave.
Mhm.
And don't take anything with you except clothes that you wash in EC3 laundry. And we'll tell you how to do that better later. But it's an individual variation. But the common thing is you've got somebody who's very sick and somebody who's not sick.
Mhm.
And so the one that's not sick believes it can't be the house because they're not sick. And so the way you can get them to see that is that just imagine that you were both eating bowls of strawberries for breakfast, but the wife broke out in a total body rash because she's allergic to strawberries, and the husband didn't. And his conclusion was, well, it can't be the strawberries because I don't have a rash. Well, he's not sensitive to it. So it's the same thing. The patient be sensitive to it and not be able to excrete the toxins fast enough not to get neurological symptoms. So that's why they're sick and the other person's not.
Mhm.
But the same holds true for that patient. That patient needs to get out of there and not take anything with them. Because when you have neurological symptoms, you don't want to wait around until they're irreversible and you got permanent damage.
Right.
You know. So this is the immune system. Now, this slides to show in chronic sinusitis, all of it is caused by an immune reaction to fungus. It's genes, it's one of 9 different genes here at the bottom. You can see the gene labels,
Mhm.
but it's a deformed receptor site on the T cell. So this little blue thing is a super antigen. Mold, for example, it's docking on the outside of the receptor site. So this is where it's supposed to dock, and it docks out here. And when it does that, you get activation of 30% of the total T cells, which is abnormal. The normal amount is 0.01% of the T cells. So you get 3,000 times the reaction actually a normal person gets for fungus being in their nose. And then that is multiplied by 3 because it secretes 3 inflammatory mediators: interleukin 5, interleukin 13, and interferon gamma. So now you got 3,000 times 3. So it's 9,000 times the systemic inflammation. So that's why sinusitis is so prevalent. And now this doesn't have anything to do with the inability to excrete the toxins. This is the chronic sinusitis gene.
Mhm.
So that's probably enough for that.
Mhm.
I'll go to the next. Now, see these red spots in here are fiberglass inside the heating and air system of this patient.
Mhm.
So this patient, normal would be to see this picture to the left, and
Mhm.
all these little red spots represent the slide I showed you previously. The eosinophils coming in to attack the foreign invader. And when they do, they release major basic protein, which makes them have a submucosal hemorrhage. So all these red spots are blood hemorrhaging from everywhere a piece of fiberglass hit. That's
Mhm.
pretty impressive, isn't it?
Yeah.
So what do you think the lungs look like?
Probably not so good.
Right. So this is why these patients can't have fiberglass inside their airstream.
Mhm.
This is a
Makes
very
sense.
graphic picture.
Yeah.
I got one more. See this? This is even worse. See this black spot? This is a scab over exposed bone. You can see the exposed bone down here.
Oh yeah.
All the tissue has been dissolved by eosinophils in this whole spot. It's so severe. See all this up here? And so it's burned the hole down to bone in that sinus. So that's very graphic. That's probably the worst fiberglass injury I've ever seen, but it happens. And this will take 2 or 3 months to heal.
Yeah.
So what do you think happens in the lungs? Same thing, right? So these patients can get very sick and get asthmatic. That's why fiberglass is the absolute no. And see the fiberglass floating in the air?
Yeah.
You don't have the flashlight, you can't see it in the air, but that's what they're breathing. It's fiberglass particles here. It's inside the system as well, not just in the attic. But this is what happens inside the system. All these particles come off.
And how, so you mentioned making sure that your centralized dehumidifiers don't have fiberglass, right? What about the rest of the house? I mean, what can we do?
The fiberglass in the unit needs to be encapsulated. It should be on the outside of the airstream and wrapped around the outside of for insulation, not on the inside. They do it that because it's cheaper and it doesn't have as much labor. But you can see would you rather have this cheaper stuff or would you rather have this stuff?
Yeah.
I think I'd pick this other stuff.
I agree.
Right. So now this is all this white stuff is yeast inside the nose. And there are a lot of misnomers about this disease, but some people think that this is when they get chronic staph infections, MRSA. Well, this patient would have MRSA, but see, what happens is the immune reaction to the fungus, which is yeast, causes pits. See these pits?
Yeah.
But they're also microscopic pits in the lining. And the pits fill up with mucus and then they fill up with bacteria. So when you chase the bacteria, you never win because you don't remove the fungus. So this is using amphotericin nebulization in the nose, and all that stuff is gone. And all the bacteria is gone too because the pits are gone. So all this white stuff is candida. All this is normal mucosa after amphotericin. Of course, they got to fix their environment too. This is mostly a dietary issue for this person. And these are mold plates. Mold counts were too high here. This is the counts inside the nose. You see all the yeast inside the nose. This white spot here is light reflex, but the yeast is gone from the mucosa, and the counts are normal down here. So this is a graphic representation of what you see in the nose when the counts get too high.
Yeah.
Now this is the mold plates. This is tumors to count aspergillus and penicillium in the person's house. So she had a big aspergillus fungus ball in her sphenoid sinus, and this is what it looks like in surgery endoscopically. This fungus ball here is this fungus ball here. So you take that out, and they get a lot better. Of course, you got to fix the house first. Or if you don't fix the house, they got it back the next day as soon as they go home.
Yeah, it's got to be a disturbing feeling for your patients to see this, and to know that that's growing inside their sinuses.
Well, yeah, it'll eventually get in your brain if you leave it in there long enough. So, and of course, it's secreting mycotoxins that go in the brain 24/7 while it's in the sinus. That's why a lot of these people need sinus surgery.
Yeah.
Now, you can have somebody with a negative CT scan that still needs sinus surgery because they've got mycotoxins. We'll show you that a little later. And fungal spores inside their sinuses 24/7, even when they're in a safe environment, making more for their brain. We'll show you how that works in a minute here. So, all right, so this is another patient. All of this is aspergillus that came from the ethmoid sinus, that yellow circle there.
Mm-hmm.
The yellow circle is this stuff on the mat here. So this person had a bad house, and this is aspergillus. And this person was allergic to all the azoles. So she couldn't take a itraconazole, fluconazole, dialphacan, any of that stuff, or she would die. The only thing she could take is amphotericin. So her lungs were infected because of all this coming from her sinuses. So her pulmonologist was a guy that graduated from Harvard, the smart guy. So I called him and told him the only thing she can have is amphotericin. And so I told him to bronchoscope her and irrigate every bronchi with amphotericin. He did so, and it cured the woman. All her lungs got well, but you couldn't have gotten her well with an IV or an oral medication. It had to be through a bronchoscope.
Mm-hmm.
And most guys don't know that. So but she's totally well now. Now this is, we did some studies. I'm going to show you where we're going with this. See, this is a QEEG.
Mm-hmm.
Normal is green and yellow, and red is disorganized thought processes, and it's high voltage in the brain. And so if you go back to here, this person had cognitive dysfunction after an airline flight. And so when she came in, she had that dysfunction. And this is what I did. If you put amphotericin directly into her sinus. See, she had surgery so I could get into her sinus easily. And so that stuff coming out of the needle is amphotericin. So we fill the sinus up with amphotericin, and then let her tell you what happened. This is patient Linda Stanley, who has noticed vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up?
For today, when you did this procedure,
With amphotericin into the sinus.
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately. All right, so that's pretty impressive, isn't it?
Yeah, very much.
Well, look what's more impressive. This happens 30 minutes after you do it in the sinus.
Mm-hmm.
The brain clears up.
Yeah.
So I wouldn't believe this unless I'd done it, but you can see the brain changes over here.
Yeah, it's pretty remarkable to see both the skin changes superficially and now seeing how the brain changes so quickly within 30 minutes to 2 hours, you were saying.
Yeah,
so
that's
great.
right. So that's why I started doing this surgery. Now, this is interesting because this is called a P300. This is an audio test, and the 300 means 300 milliseconds. So, and when you put a sound at the eardrum, it takes 300 milliseconds for it to reach the brain. That's normal.
Mm-hmm.
Okay. So you see, all these mole patients have extended periods of time. See, this one never, when the red line crosses the green line, that's when the brain hears it. Okay. So this person never heard what you said. So they're nodding, but I make them write it down, or they, so they own it. Because if you just do verbal communication with mole patients, most of them will not go home with any information. So they have to write it down. And this is why. Their brain never heard it.
Mm-hmm.
And you go down here, this is 461. It's still prolonged. 300 is normal. So it took 461 milliseconds to cross for the brain to hear it. That's kind of impressive, I think.
Mm-hmm.
It shows you why they're disorganized.
Yeah.
They can't process the information.
Mm-hmm.
All right, so this is really an important slide. This patient didn't want to be seen, but she wanted to be heard. All right, so see, her CT scan is not that bad. She's got a little bit of swelling and thickening in here, but normally nobody would operate on that. But after we did operate on that, the tissue here is on this mold plate here. See that mold plate?
Mm-hmm.
see this brown halo around that? The
Yeah.
brown halo contains aflatoxin B and ochratoxin A. When you take the brown part of the plate and assay it, it's got aflatoxin and ochratoxin in it. Isn't that amazing?
Yeah.
All right, and this is what happened to her. This is audio on her.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
See,
That's
that's why I
amazing.
do this job.
That's
That's
amazing.
why I do this job every day.
Mhm.
So now the next slide is this is the same person, but this is her QEEG. So if you go from left to right, the left's pre-op, okay? So red is bad, basically. And then the right is immediately after surgery, you know, after she healed,
Mhm.
post-operatively. See this?
Mhm.
She's massively better than the red over here, right? And then finally, when she has neurotherapy, it's all cleared up.
Yeah.
And a lot of these people need neurotherapy because without that, they can't stop the OCD behavior and some of the other things that happen to them, like their cognition, their memory loss, concentration problems, obsession over, you know, obsessive compulsive. A lot of these patients get hung up in that. Like an example would be a patient had, she would move into a hotel room that she felt good in and would throw all the clothes away, get new clothes. And then after a few weeks, she would decide that she was reacting to the hotel room. She was having a physiological reaction to the hotel room. So she'd leave that hotel, go to another one, throw all the clothes away until the wallet's empty. Well, the problem was, it wasn't the mold, it was the brain damage that the mold caused. And her reaction was in response to having a physiological reaction because she had brain damage. So if she didn't get neurotherapy, she could never stop doing it.
Mhm.
See, so that's why a lot of these patients need this.
And when you say neurotherapy, do you mean like neurofeedback therapy or like cognitive behavioral therapy? What seems to work best in your opinion?
Well, all of them work to a certain degree, but this was you watch a movie or something you want to watch, and you have the electrodes on, and then the movie goes blank, and your brain wants to see the movie. So the brain goes through every way they can make until it can see the movie passively without you doing anything.
Yeah.
And then when it can see it, it locks in, and that's the correct way. That's the therapy that I'm talking about.
Yep.
And you know, you're familiar with all this stuff.
Yeah, neurofeedback, definitely helpful. Yeah. So I think
Yeah.
we had a podcast specifically on neurofeedback a few episodes ago with Dr. Henry Zaremba, if listeners want to check that out.
Yeah. So, you know, I knew that they still have some in there, and this is how you get it out. This is, you get the damage healed this way. The toxin's already gone, but you've got residual damage that they're having a behavior to that's inappropriate, you know. So it can also be, they can still have depression, but you see the depression went away after getting the toxin out of the brain. So now this is not the same thing. This is brown halo was assayed, and on down the line we'll show you. We did these biopsy sites. We know where the biopsy site was, and that's how we started doing artificial intelligence to be able to see these things. I'll show you that in a minute. But the brown halo means it's a toxin coming out of the tissue. We know that because we assayed the tissue. and then we assayed the brown ring. It's the same toxin.
Mhm.
Okay, so this is the normal piece of tissue. You don't see a brown ring around it. That's the
Right.
control.
Okay.
And this one has the brown ring around it. This is just more of the same stuff.
Mhm.
This is the cyclone video. This is what the cyclone looks like, how you do this through a telescope. This is a mannequin, so you can't really see blood, but so it has 6 ports. It'll show you the rest of it here. Stryker is a company that sells these to surgery centers. So it sucks at the same time, so it doesn't go anywhere. See how fast it sucks? It's sucking as fast as it irrigates. So the toxins don't go anywhere. See? Got 6 ports here. And anyway, I think it does an amazing job. And this is what it looks like in surgery.
What's the recovery time like after this? Is it pretty quick?
It takes 2 weeks to sort of get over the surgery. Now you could walk 10 miles the next day, but you can't do any bending, stooping, and lifting.
Mhm.
And you have a stuffy nose for about a week, like you got a cold, and then it opens up and it's a good airway the rest of the time. But athletics, you get at least 2 weeks.
Mhm.
You know, so no bending, stooping, or lifting for 2 weeks. That's average. Some people may be longer. It depends on how fast they heal.
Yeah.
And so this is see how different this person looks. This is, she came in the clinic. This is immediately after surgery. Look at the difference between these 2 people.
Yeah, 2 different people completely, yeah.
Yeah. I mean, it's unbelievable, isn't it?
Mm-hmm. Yeah.
That's just getting rid of toxins in your brain.
Mm-hmm.
Now this is the same thing. This is the mole right here.
Mm-hmm.
The air is black in an X-ray, and gray is soft tissue. So this is soft tissue polyp formation that's caused by fungal exposure. There's fungus present in there, and when you assay this, they're positive all these toxins.
Mm-hmm.
And so this is what he said. This guy had hearing loss for 10 years.
So
But
I'll let him finish.
Brought out of anesthesia for about 20 minutes now. The first thing I noticed as I came to is my hearing improved drastically. I could hear the conversations in the room next to me. I'm still trying to determine if the tinnitus is completely gone or just mostly gone. The ringing is obsolete.
okay. So
Quick question on the CTs again.
Yeah.
So we're looking at it right now and it looks pretty obvious. Is this something that typical radiologists are gonna pick up on if they do a CT scan of the head and they get the sinuses in there as well?
the average radiologist would call this one.
Okay.
They would call all this.
Mhm.
Now, what, and they see this swelling on the bottom of the floor here, the maxillary sinus,
Mhm.
it's big down here
Yeah.
and up over here. That
Mhm.
means something. That means they're breathing fungus. So
Mhm.
you know, if you see this inside the nose, see that swelling right there?
Mhm.
Flourish doesn't have swelling in it, but the medial does. That's how you know they're still in a bad environment. They're still in reactive environment, just by looking at the CT scan.
Yeah.
And then, any other questions about that?
I don't believe so, not right now. Thank you.
Okay. All right, so now this is really important. Most of these patients have pituitary damage. Why? Because this is the sphenoid sinus, and the stuff goes both by the olfactory nodule and through the bone into the pituitary gland. And I'll show you this. We actually had one patient had a pituitary tumor. So when the neurosurgeon took the tumor out, we assayed the tumor and found 11 mycotoxins in the tumor itself, which is probably why they had the tumor to start with.
Mm-hmm.
So that's never been published before, but we'll publish that eventually. But if you look at this, we did several patients, and 51% were growth hormone deficient
Mm-hmm.
who had normal resting levels of growth hormone.
Mm-hmm.
So they would have never been worked up, you see.
Mm-hmm.
So again, they had normal resting levels of IGF-1, but they couldn't make their own growth hormone. Without injectable, they would have rapid decline and rapid aging and finally die, but it would take a while. So none of those people would have gotten treated. So the take-home message is the IGF-1 normal range is not normal. Okay.
Hmm.
So 51% had growth hormone deficiency, 81% had thyroid deficiency, and 75% had cortisol deficiency. So most of these patients need support with hormones to get them back to normal levels. And we like them to be mid-range.
Mm-hmm.
We wrote a paper about this with two endocrinologists. So you've got to work up this piece. If you don't get the hormone piece, you can't get the brain well. You got to get it all well.
Right.
Okay. And so this is the data from that study. That 79 patients, IGF-1 average was 123. Look, normal 88 to 249. The average of people who couldn't make growth hormone was 123.
Mm-hmm.
That's amazing, isn't it?
Yeah.
So the range was 43 to 285. Well, who would have worked up the 285 guy? Nobody.
Yeah.
Right?
Mm-hmm.
It's just over normal. Still couldn't make growth hormone. That's amazing, isn't it?
Mm-hmm. That is.
So you got to listen to the patient, not the blood work.
Right. Yeah,
Okay,
that's so important.
So 51% were growth hormone deficient, 40 out of 79. That's a lot of people who were going down the tube without growth hormone.
Mm-hmm.
Right? So if IGF-1 is below the 50th percentile, most of them are growth hormone deficient. So all you got to do is look at their number and add the range together, these two numbers, and divide by 2. If it's less than that, they probably have it.
Mm-hmm.
Easy to do, right?
Yeah. And then I assume you, after checking this and doing the surgery, values get better, people get better.
And that's a really good question.
Mm-hmm.
If they're growth hormone deficient, you like them to get on growth hormone replacement before surgery. Why? Because they'll heal faster. And then you don't withdraw it. You see how they do over time, and then you can lower the dose or even stop the dose and see what they do. Some of them will regain function again, and some of them won't. I can't give you a percentage. I don't know the answer to that. Okay. But it does happen where people get the function back of the anterior pituitary. But I think it's more no than yes.
Okay.
Now this guy,
Wesley Baker, 6'25", 18", left trimmer.
all right, so see, look what he looks like now. So he's better.
This is after treatment of mycotoxicosis.
All right, so
Totally better. Yep.
all right, so that's from all the stuff we did. Now,
Mm-hmm.
what did that guy do mainly on his side? He moved out.
Mm-hmm.
It didn't take anything with him. But at first he didn't. And he was having a hard time getting better. So you got to stop the exposure to get well.
Mm-hmm.
And yes, drastic, and it's hard to do. A lot of people can't do it. But what's your brain worth, right?
Right.
Is it worth a move?
I think so. I mean, it's everything. So
Yeah, well, I think probably half the people think it's not worth it. So they don't move. Now, this guy was in a wheelchair for 2 years.
Mm-hmm.
He couldn't stand up without help. See, these people have to help him stand up. So this is what he looks like.
Brain, fibromyalgia, muscle weakness. Now go backwards.
and then sit in the chair.
Okay. This is what it looks like now.
Yeah, totally
I'm
different.
Green. I'm now living on the coast of North Carolina, and I'm living right here on the water, where there's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's zero mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. And now living here where there's a zero mold count, I'm healthy, I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
All right. So I've got a couple more of these, then we can talk about it. So this patient had blindness and eye paralysis and leg paralysis and a tumor on her spine and a catheter.
This is Jennifer Parrish, who had a severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins.
Okay, so this is about 6 weeks later.
This is Jennifer Parrish on 11408. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back, and her neurogenic bladder is over, so she can urinate properly. And she had a mass around her spine, which has gone away. This is all on Sporanox and vitamin supplementation, and her vision's coming back while they're chelating her for heavy metals.
All right, I'll show you this one because most people, if they get well, they always ask, well, when can I go back in the mold? Because I'm well now. And this series of videos tells you the answer.
Mm-hmm.
That's the best he can walk. This is after we treat. This is 6 weeks later. Right, so he's all normal. So he's normal there. And this is a month later. He comes back and gets a moldy car at the airport. He's in the car for 30 minutes, and look what happened to him.
Mm-hmm.
That's the answer to the question. Never. You can't ever get back in it.
Yeah.
That's pretty graphic, isn't it?
Yeah. So once you kind of identify a patient who's susceptible, I mean, they just really have to be on it for the rest of their life. Yeah.
Yeah, it's like I tell them to think of it like this. So you took penicillin on and off your whole life for one thing or another, and then you had an anaphylactic reaction to penicillin. And then your question is, well, when can I take some more penicillin? Never. It's an immune reaction.
Mm-hmm.
And so you can't get rid of it. Now you can make it better for sure.
Mm-hmm.
I'll show you some of the things we did. This person had vocal cord paralysis. When she got out of the dental office, that's where it was. It went away. So now this is what I wanted to show you.
Mm-hmm.
This is new technology. This isn't released yet, but we've got about 100 patients so far. This is the first time in history anybody's ever been able to see mycotoxins in the sinuses and in the brain. We can now see them in the sinuses and in the brain. So what we did is we took the test tubes of all the mycotoxin from the lab, and we CT scanned them and MRI scanned them all, and then ran that data through 7,000 algorithms until we could see something in that vial. Now, if you look at the vial in real life, it looks like there's water in it. It looks just like water. You can't see anything in there.
Mhm.
So one of the algorithms showed a black substance in there. See this?
Mhm.
Then this CT over here was a known biopsy site is circled here. We took that tissue out, and that tissue had mycotoxins, gliotoxin on that tissue, on that site. So then we ran the same algorithms on the sinus, and you can see, I don't know if you, let me just try this. That's not bigger, is it?
Nope.
Okay, it's the same size, right?
Yep.
Okay, so do you see a little white arrow?
I do. Yep.
A little white arrow in there is pointing to a black dot. The black dot is the mycotoxin in the sinus.
Mm.
So it's the same signature as this.
Mhm.
But we know now, I'll show some more. Okay, this is some of the brain, and this is trichothiocene is black here. Turns out most of them are black, but now this guy had a colloid cyst in the left ventricle of his brain, causing severe daily migraine headaches. So we ran his, in his urine, he had gliotoxins in the urine. So gliotoxins showed up as blue with red dots on it in the test tube. This is the test tube.
Mhm.
So look what it was. It was a gliotoxin encapsulated in his brain. They made a capsule around it to protect his brain from the toxin. Isn't that amazing?
That is, yeah. So how
So
when it gets to that stage, is this something that the surgery can benefit? How do we actually
well, you can't
get
get
at
that out
this?
of
Yeah.
now you can't get that out of the brain. You can't operate
Right.
up there on the brain. You can operate on the sinuses, and I'll
Right.
show you other stuff here where we can show you how we get it out of the brain.
Okay.
Now this one, see these little, many patients have these little white dots. This is the junction of the gray and white matter of the brain where the capillaries are the smallest.
Mhm.
And that's where they get infarcts. So these are little infarcts from inflammation inside the capillary. You see that?
Mhm.
So there's radiologists just passes these off because some people have them. But look what's really wrong. Look at all the stuff that's in the brain.
Yeah.
It's a lot worse than that.
Mhm.
So now this person is totally well at this point. But now this is the one I wanted to show you. Okay, this right here, this vial contains gliotoxin, which is a black substance. This is a pituitary gland. That black thing in the pituitary gland is a tumor, which is secreting cortisol to such an extent the person has 100-pound weight gain and diabetes.
Mhm.
And it's going to die if the tumor is not removed because of the huge amount of cortisol she's secreting every day.
Mhm.
So the neurosurgeon goes in through the nose, takes the tumor out, and then we get a piece of the tumor and do a mass spec on the tumor to assay it for all the mycotoxins. So guess how many mycotoxins were in there?
How many?
11.
Okay.
So over on the left side, all this black stuff represents 11 mycotoxins in the brain. Those two little dots are in the pituitary gland.
Mhm.
And pituitary tumors are frequently recurrent. And the reason is they're most likely, at least some of them, an environmental illness from fungal mycotoxins. So all the black stuff is 11 or more mycotoxins, judged by the results from the mass spec on that biopsy from the tumor. You understand?
Yeah. Jeez.
Okay, so now I'm going to show you some more stuff.
Mhm.
So this is two toxins. Both of these are black, but all the black stuff in the sinuses is mycotoxins. All that black stuff is mycotoxins. That's pretty
It's
impressive.
crazy. Yeah.
All right, so now this guy they had a huge pituitary tumor.
Mhm.
I'm going to show you him a little bit. He needed surgery really bad, but he didn't want surgery. So went to the neurosurgeon. And they're doing medical therapy, which ain't going to work, but he'll need surgery eventually. But so see, look up here. This is a cadaver showing you the anatomy. So this is the airway down here. This thing right here is the internal carotid artery to the brain. So if you go look over here, you see he's compressing right here. He's compressing that internal carotid artery to the brain with his tumor mass. And it's outside, and then he's tinning up. See that right here is the cross of the optic nerve on top of the pituitary. And he's tinning that up with this huge tumor size. So he's going to have to get that fixed. And this is, well, okay. I've got one that I can show you, but basically, this is interesting because you see the left one over here. This is a regular CT scan. See the air bubbles in there?
Yeah.
So this is active bacteria, we think, in there. But if you go to look at this is the IA, artificial intelligence software. So you see the liquid is down here. So it's a gray substance. But above that is a gas, which is the VOCs, I believe, that's coming off of this. So you see the white stuff in here. See, there's no white stuff over here, but the white stuff is probably the VOCs. I think this is the first imaging in history where you can see VOCs in the sinus. It's kind of interesting, isn't it?
I mean, it's incredible that we can observe that now.
Yeah, but well, it's not mainstream, but it's going to get there. It'll be, so when you see it in your brain, most people don't want to do something besides stay there, right?
Yeah, right.
Well, there'll still be those that want to stay there, but not many.
Yeah.
Okay, this is what we know. When one mycotoxin is present in the urine, 10 or more are present in the brain. Isn't that amazing?
Yeah, I mean, scary, but yeah.
Okay. Okay, some pituitary tumors are likely caused by mycotoxins. Since they are found in pituitary tumors at high concentrations, they're known to be tumorigenic. And the tumors have high recurrence rate. So at least some of these are. That'd be nice to just fix your air, wouldn't it?
Yeah.
So airborne mycotoxins enter through the nose and are randomly distributed to many areas of the brain. Mycotoxins can be removed from the brain with a combination of environmental, medical, and when indicated, endoscopic sinus surgery using an amphotericin with a cyclone. Now, everybody doesn't need surgery, but everybody needs it out of their brain. So I've got another picture. It shows it leaving the brain after a year, but this is doing oxygen, glutathione, NAC, liver cleanse, and Intramax, and irrigation of the nose with saline, with citron drops, and putting amphotericin through a nebulizer into the nose. That's how we got it out of the brain. So, this is a sliders everyone should copy because they'll save them a lot of time. Why am I not better? Number 1 through 10 is you're still in it, either knowingly or unknowingly. That's almost every time that's the case, just about.
Yeah.
Not 90% of the time, the fungus load continues in the air and the belongings. You take a history and do mold plates, and you do mold plates to see, do you have it in your house anywhere? It can be in a front loader washer, it can be in the car, it can be in animals. Don't sleep with animals because they're tumors to count fungus on the mold plates. BMW, some of the BMWs don't get rid of the liquid in the inside the air conditioning system. It doesn't get out, and so some of them get mold. And then patients react 9,000 times normal to systemic inflammation. So you got to have 0 to 2 mold colonies to get well. And if the medical treatment fails, you need probably sinus surgery.
Mm-hmm.
Now, some of them we can have, quote, normal sinus CTs, but have inflammation that you can see and still high urines. And we know they're out of it because we measured everything and they're still not getting better. Those people need surgery.
Do you find that the majority of people are able to get better with, say, like anti-mycotoxin nasal sprays and kind of more?
Well, you got to irrigate first. You got to irrigate really well. The best thing to irrigate with is a lavage.
Mhm.
All the stores have those. If you can learn how to use that, that's the best unit on the planet. And we have one on our webpage. We don't have lavage, but you can squirt it with a squirt bottle, put citral drops in there because it kills fungus, bacteria, mycotoxins, VOCs.
Mhm.
It gets rid of that. And then you're going to use oxygen 2 hours a day with a face mask, 100% oxygen, and while you're doing something else. And then you do all the antifungals. You can use itraconazole or nalthacin. You got to be on the diet. And so without the environmental piece in the diet, virtually no one can ever get better. You have to do both of those.
Mhm.
You got to be committed to do both. If you're not, don't worry about spending money on doctors because it's not going to help you. You can take, 5 million things a day. It's not going to work
Mhm.
because you haven't done number one and number two.
Right.
You got to get the load off of you. And so I would say, in my experience, half of them need surgery, half of them don't.
Mhm.
That's a guess. Everyone's different, and some people have a negative CAT scan, and that's hard because the technology is new, and the insurance companies are not paying for that because they can't see anything in their world. But we can see the mycotoxins in the brain.
Now, Dr. Dennis, when it does come time to do the surgery, is it typically only one procedure that patients need, or is it a series of procedures?
That's a really good question. Occasionally, we have to operate on somebody more than once,
Mhm.
and not very often. And sometimes they get scarred down, and you got to do revision because they get trapped. Something gets trapped. But I think that's really a single-digit percentage of people.
Mhm.
Most of the time, it's one procedure. It takes about 2 hours. General anesthesia. You stay, and then you go home that day, or to a hotel if you're staying from out of town. And then the next day we have a pack in the nose that's a soft sponge, and that comes out the next day. And the rest of it dissolves automatically.
Mhm.
And it takes 2 weeks to heal, and you can't do any bending, stooping, or lifting. Now, the next day you could walk 10 miles, but walking like you're going to the bathroom, slow walking, no speed walking.
Mhm.
The whole danger of violating the post-op rules is bleeding. Bleeding can be very dangerous, and a lot of it. So
Mhm.
if you follow instructions, you're not going to have it. If you don't follow instructions, you can make yourself spend all your time in the ER.
Mhm. Follow-up question there. Is this procedure something that is common in the United States, or is this something that only a few people like yourself are
Okay.
performing?
So that's a really good question. Every ENT guy worth his salt knows how to do the surgery itself.
Mhm.
What is different is the irrigation device and what you're putting in the irrigation and how you're doing it.
Mhm.
That part takes about 15 to 20 minutes. That's the last part. So you're putting that in all 8 sinuses, and you're irrigating them with 120 cc's of amphotericin or voriconazole, depending on which one works best for them.
Mhm.
So but the whole problem is most ENTs, if they can't see a big fungus ball, don't believe fungus is causing the chronic sinusitis or the neurological symptoms. They don't understand that.
Mhm.
And so they could easily learn how to do this if they were interested. And of course, I've written an article about this and has all the instructions in it. So they could read that, or I would be glad to talk to any ENT that would want to call me and ask me how to do it.
Mm-hmm.
But I'm not calling any ENT. That's not going to happen.
Yeah. They got to initiate. Yeah.
Yeah. So that would work.
Mm-hmm.
So the other thing is you got diet, air, pituitary, depressed immune system, heavy metals, and the MTHFR, you can't get rid of anything, and lymphoma, leukemia, that's rare. That's waste. That's probably 2%, 3%. So that's the slide you need to go by of why I'm not getting better. Before you work on number 3, get number 1 and number 2 right.
Mm-hmm.
This is the case with most people who don't get better. So it's not something the doctor can do for you. You got to do it yourself.
Mm-hmm.
So this is our summary. Clean air, you got chlorine-free water. Chlorine grows out fungus, basically, because it kills bacteria. Get mold off the table with tap testing. And the highest concentration of mycotoxins in the sinus mucosa. So you got to remove that endoscopically if you can't get it out medically. And then evaluate the pituitary, and then know how to lower your air content. Do the filters and the fogging, and use the ionizer and the saline nose washes in the nose with after nebulization. And we use we do basically the glutathione, NAC, liver cleanse, and Intramax. Intramax is a liquid vitamin. You can get online. You get the one that says sugar-free or unsweetened. It says unsweetened. And it's got 413 items in it bound to carbon. So the nutrients go intracellularly, and the toxins sucked out by the carbon.
Mm-hmm.
So that works really well. And most people can tolerate it, and it's easily available online. Intramax. This is Intramax down here. So this is all the stuff we do if you want to see. It's a face mask, not nasal cannula. It's 100% oxygen at 10 liters a minute, an hour to 2 hours a day, and you titrate it. If you start having symptoms and you turn it off, that's your time.
Mm-hmm.
Oxygen's a big deal for getting it out of the brain. You got to do that. You're not going to get it out of the brain without oxygen. So don't fight it, just get it, and then this is the rest of it, all the medicines we use. And I'm not against binders, but honestly, I don't have to use them very much.
Mm-hmm.
All these are fine. I would say that binders, I use humic and fulvic acid, which is really easy to do, and that works fine. And if you need cholestyramine, you don't need it forever either.
Mm-hmm.
So, and we use diflucan and nystatin, and then we'll switch to Sporanox, itraconazole, or voriconazole next. I think voriconazole works really well for a lot of people. It gets into the brain better than the rest of it.
Mm-hmm.
And then this is our Sinus 5 is our site that has all the stuff that we sell on it. And Sinus Wellness has all the information on it. So these are the 2 major websites. And then we got some slides. This is interesting. This is a product we sell. It's called Sinus Defense. It took about 20 years to do this, but basically, it has all the, you take colostrum. Colostrum has transfer factor in it. So over many years, we've made the transfer factors to all these organisms. And then we put the frequency of all that in this bottle. And the frequencies work better than the real transfer factor pills from the cow. It's pretty amazing, isn't it?
Mm-hmm.
I don't know if you
It's amazing.
do those things, but
Yeah.
so all this stuff in here has got transfer factors to all these things. Strep, staph, Diplococcus, pneumococcus, Haemophilus. It's
Yeah.
like, and all these fungi. And then IgG subclass, Epstein-Barr, cytomegalovirus, it treats all these things. It's got Lyme's, Epstein-Barr, cytomegalovirus, and the 3 herpes are in there. And also the antibodies to the stem cells of patients who never get sick in severe toxic environments.
Wow. So that's pretty big.
So that, you know, you can swim in it. It can't hurt you.
Yeah.
So you do 9 or 10 sprays on your tongue 3 or 4 times a day, or whatever it takes for you to see something. So that's, and then we do, we fog the office. If a patient comes in, it's kind of moldy, we fog the office, we fog the patient, we fog the gown, put the gown on, fog me, fog the gown inside and out, fog the hat, and then I put on 100% oxygen. If a patient has got mold issues, because I can usually tell if I smell it. And then that's how I protect myself. And then we fog the whole office. But this fogger is on our website. It shoots 30 feet. You can fog your whole house every day if you want. That helps a lot.
So Dr. Dennis, I hate to cut you off because we're getting into some good stuff again, but we are running out of time.
Okay.
So are these slides something that's available if people wanted to follow up on some of these products? And how would they find out more about you and your products?
Okay, so what they would do is go to sinus5.com. That's where all the products are, sinus5.com. And then go to Sinusitis Wellness for all the articles. And then my practice is called Atlanta ENT and Facial Plastic Surgery. But if you just Google Donald Dennis Atlanta, I'll come up.
Yeah, you find them. Yeah. Yeah, and I hate to cut it here, but this was a lot of great information, and I think this is going to give a lot of people something to really bite into. Maybe takes a couple listens.
So I can send these probably to you.
That would be fantastic, and I'll put them in the show notes for people to browse through then on their own.
Yeah, then all this stuff people want. It's just after creating mold-free environment, all the slides after that. So I can just put those out to you.
Perfect. Yeah, that would be a great resource for our listeners. So I appreciate that, Dr. Dennis.
You're welcome.
Okay. Well, again, I really do appreciate you coming on today. This was phenomenal. I've really enjoyed learning from a lot of your other webinars as well. So it was great to get to have you on the show and talk to our listeners specifically. So thank you.
Well, hopefully you can help some people.
Yes, hopefully that's the goal, right?
Yeah. But got to get out first, though.
That's right.
Half of them will do it, half of them won't. You can't change it, I don't think. But I think education is the main thing. If they understand what's happening to them, I think they get more active.
Exactly. Yep. Step 1, though, you got to get it out. So.
Okay.
All right, Dr. Dennis.
Have a good weekend, everyone.
Thank you. Thank you, you too. We'll talk to you soon.
All right. Thank you.
Yeah.
Bye.
Take care.